Whooping cough comes in waves about every 4 to 6 years. We always have a lot around in community, but currently we've got a very large amount in the community. So everybody in New Zealand is at risk of catching whooping cough at the moment.
Whooping cough is a serious disease no matter what age you catch it. In the adult, you don't want to be coughing for 100 days. It's very unpleasant. For a newborn baby or a very young child, it's catastrophic. They struggle for breath. They've got very little resilience about how they will keep on breathing. And to see a struggling child with whooping cough is one side I never want to see.
In New Zealand, if you end up in hospital as an infant with whooping cough, you've got a 1 in 10 chance of ending up in the baby intensive care unit. And of those in the intensive care unit, you have a 1 in 6 chance of ending up with severe lung damage, brain damage or death. This is a very severe illness. Whooping cough is actually a very common disease across the whole community. We recognise it in the infants because it's so severe. It often goes unrecognised in adults. In fact, probably 20, maybe 30% of adults who have a cough lasting more than 2 weeks may well have whooping cough. So there's a lot of whooping cough out there in adult people, in the elderly, in many groups in our population that's currently not being recognised, and they're at risk of spreading their disease to others.
The only way, the absolute only way we are going to get the protection that we need for these young bubbies is by immunising. We need to immunise these young bubbies as soon as we can. We're going to use the standard immunisation schedule vaccinations at 6 weeks, 3 months and 5 months. That's important to do those base ones, but it's also going to be important to immunise those people in and around that newborn child until they've completed those 3 immunisations.
For those of us who are in close contact with young infants, we can also be vaccinated against whooping cough. So think about parents, grandparents, anyone in close contact with young infants up to about a year of age. Pregnant women also can be vaccinated after 20 weeks of pregnancy.
What we really are after is to reduce down the risk of that mum bringing whooping cough into her household that might infect her unimmunised or partially immunised child.
Her lips are going purple.
Whooping cough is a tricky disease. You don't get protection for life from either having the disease or having the vaccine. So sadly, even if you've been vaccinated way in the past, you can't guarantee protection. You still need to think vaccination.